Hi, so today we're going to be doing our tracheostomy suctioning and cleaning kit. I will verbalize the suctioning part and yeah, let's get started. Okay, so we're gonna start off by verifying and checking the orders. I have them right here. So we are gonna start by stating the name. Wanda Chi, MRN 8729. 2301, date of birth 07/15/19XX. Allergies, no known allergies. Physician's orders, tracheostomy care Tuesday, Thursday, and Saturday, using normal saline at 0800. Suction to bedside and suction tracheostomy PRN at 0800 as well. Signed by the physician. So that's ready. We read the orders, verified it, and we're ready to go. We're going to gather our supplies. So we have our normal saline. Here it is. Okay. And then we have our suction kit. Here we go. We have our tracheostomy care kit. Okay. And then we have our gloves. And so that is all that we have. And we are ready to go. We're going to make sure we're checking all the expiration dates on everything, making sure they're good to go. Okay, everything is good. Then, since the patient does have a tracheostomy, the patient will be unable to talk. So you're going to try to come up with like a method, like raising your hand. If the patient is in pain or uncomfortable, if you ask yes or no questions, the patient will nod or shake their head. So you have that, and then you can just tell them to raise their hand if they feel any discomfort or just want you to stop real quick. So you have that. So now we will go into the client's room, the patient's room. Okay, so you knock, knock, knock. Introduce yourself. Hi, my name's Emily. You just check my name is Emily. I'm going to be your nursing student today. You check their name, their patient ID, their name, date of birth. What is your name? My name is Wanda Chi, date of birth 07/15/19XX. Do you have any allergies? And it'll say it on the computer. You'll ask them, are these your allergies that you have or no allergies? They'll say no. Okay, so you have that. You provide privacy and let them know that if they have any discomfort that they can raise their hand or to let you know to stop. So you will perform hand hygiene and state that and then after you perform hand hygiene, you will let them know why you're there. So you'll state that the doctor ordered a suction. So you're gonna have to make sure that so that they have a clear airway, and that you're also going to clean around the trach, just to prevent infection. And then you ask them if they have any questions, and the patient will shake their head no. So then before you start, you're going to assess their vital signs, their pulse oximetry, and then you're also going to auscultate the lungs. So after you obtained all the vital information, you're going to make sure that they know what you're going to do and that you have all the vital information you have to start. And you're also checking to see if their oxygen percentage is low. If it's low, that means you need to clear the airway, so to give them a better oxygen. Okay, so to suction, you have to have the right amount of suction. You have to set it to 100 or 120, because if it is too high, it can cause tissue damage, and if it's too low, it won't work effectively. So you're going to make sure that your suction is always set correctly, and that if they're connected to oxygen, that it is working. So you have to verify that you have good suction, and then you're good to go. You want to make sure that that the bed is raised and the patient is put in a high Fowler's position. That is very important. The privacy has been provided. We perform hand hygiene. And if you need any PPE to put on, so due to like sometimes the patient may cough and some phlegm may come out of their trach. So you can put goggles on, any like contact isolation gowns, just to be careful, because you never want to stand directly in front of it. You always want to stand on the side if they cough or something. You don't want all that coming at you. So you're going to use a sterile table. All this is sterile here. We're always going to maintain sterile procedure because that's very important. So we're going to just make sure that the sterile table, and I'm going to verbalize opening the suctioning kit. I'm just going to tell you what is in it. It has a whistle tip suction, catheter, vinyl gloves, sterile wrap, and a cup. So that cup, you're going to pop open and then you're going to do this before putting the sterile gloves. You're going to pop open that little cup, touch it, open it, pop it open, and you're not going to touch the inside of the cup because you're going to put the saline in there. So you're just going to pour that in there, and then I'll just keep maintaining my sterile technique, and that little cup will be open with my saline in there. And you're also going to want to hyperoxygenate the patient before putting your sterile gloves on. And then you're just going to get your ambu bag, and you're going to give like 5 to 6 breaths over 30 seconds, and that will hyperoxygenate them while you're doing your suctioning, sorry. So you're going to put on your sterile gloves while maintaining the sterility the whole time. Then you're going to remove the trach suction kit. Make sure it does not touch anything, and because you want it sterile. Okay, so you're going to have one sterile hand. Mine will be my right hand, and my dirty hand will be my dirty hand. Yeah, sorry. So you're going to remove that. So you're going to remove your trach suction kit. Make sure it doesn't touch anything. Sterile hand, I will hold it, my suction, that little, the whistle tip suction, and then, my catheter that will go in. This will be in my sterile hand. My dirty hand will have the suction tubing. So the part that you put your finger on and off to make sure that the suction is working. So you'll connect it with your suction in that little part, and then you're going to put your finger over it. You're going to dip it with your sterile hand in the normal saline to make sure it is suctioning, and you're just going to go like that. So you're going to hear that shh, 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 shh. So it is working. So after that, you did that. You have your sterile hand with the catheter, dirty hand. With that, you're going to connect it to your suction. That's why it's your dirty hand, and that's what you're going to check if it's suctioning. So you go, now you go to your patient with your sterile hand, and you will go down the trach until you feel resistance like this. And you will apply suction by going on and off with your finger. You do intermittent suction and do it in a rotary motion while slowly taking it in and out like that. So just like I'm doing, slowly. And then you won't suction for more than 10 seconds at a time. You usually need a suction one time. You can do it 2 to 3 times, but you usually should get it all in that one time. And you don't want to do it for more than 10 seconds. So after that, that part is over, the suction. You roll up the catheter with the glove. That is the end of your sterile part for suctioning. So you're going to clean next. Then the suction's over now. So you're just going to roll up the catheter in your hand. Then throw gloves away, chunk over there, and perform hand hygiene. So I perform my hand hygiene. Now the cleaning part. So we're going to get our trach kit. This part we're actually going to do. This is your trach kit. Whew, sorry, I'm out of breath. Okay. Verify the expiration dates, making sure everything's good. Okay, so we're going to just perform hand hygiene and then don the gloves. We made sure we kept the sterility technique through the whole thing. Okay. So we're going to remove the trach dressing right here. Okay, so we're just going to remove it. Okay, so we're gonna check for the coca, the color, odor, the consistency, and the amount. So, it's not a lot. The color is not abnormal and all of that. So we are now going to note that so we can chart it later when we're done. And then we're gonna just dispose of that with our gloves. So we disposed of that and we disposed of our gloves. Okay, performed hand hygiene. And then now we are going to have the saline open before we open the kit. So here's our saline. It is open. Okay, hands are clean. So now we're just going to open our kit, maintaining sterile technique. Okay. All right. So here we have, okay, here's a view of it. So then I'm just gonna grab my drape, the tip of it, the tip of the drape, and then we're gonna just making sure we put the shiny side down. Okay, so shiny side down, maintaining sterile technique. I'm not gonna touch all of it. Sorry if I broke sterile technique. I'm not gonna touch all of it. I'm just gonna lay it down, only touching the tips. This is my sterile field. Okay, everything's sterile. I didn't break it. We're good. And then that will be my sterile field. I'm gonna just put on one sterile glove. It'll be my right. Okay, so just gonna put it on. Okay, there we go. This is sterile. We're gonna put on our sterile glove, which is my right hand. And I'm gonna use this and move all the equipment in my little bag to my sterile field. Okay, making sure it all stays. I'm not breaking sterile technique. I'm putting it all in there. Okay, on my sterile field. Sorry if you can't see it. Okay, I'm just gonna put you a little lower so you can see it. Okay, perfect. I'm not breaking sterile technique. No, sorry. Okay, so after that, I put all of my stuff on my sterile field. I'm gonna use my dirty hand to pour my saline in my compartments. Okay, so here's our container. I'm gonna use my dirty hand to pour the saline in my compartments. Okay, so we have 3 compartments. One is to put the dirty stuff over there, and then 2 is to clean them. So I'm poured it in my compartments. After that, I'm gonna put my other sterile glove on. So we're just gonna not break sterile technique. Okay. Other sterile glove is on. We stayed sterile, okay? My one hand will become my dirty one, so it'd be my left, and then my right hand will be sterile. So that's my sterile hand, my right. Okay, then my dirty hand will remove the trach. Okay, we removed it. Okay, put it in the dirty basin, and then after that, we'll just let it soak over there. Then we'll pick up the trach with the dirty hand, and then we will clean it. So we'll pick it up and then we'll clean it. I'll grab a clean one here. Okay. And then we'll clean it. Okay, clean. And then we'll let it soak. I'll toss this. Okay, I'll toss it. Over there's my trash. Okay, and then we'll let it soak. And then now, with my sterile hand, I'll just, there we go. And then I grab the tube to clean it. And then we throw that away. Then we put the trach in the other compartment, and then we grab it again with our dirty hand, and then we dry it off with our clean hand. Oh my God, I'm sorry, it's getting stuck everywhere. Okay, and then we just dry it off. This hand remains sterile and clean. This is my dirty hand with my trach in it. Okay, after that, we'll dry it off and place it back in. I'll place it back in with my dirty hand. All right, after I put the trach in with my dirty hand, the sterile part is over. So I just put it in already. This is my dirty hand. Okay, now we're gonna clean the outer part of the trach. So I'm gonna grab a Q-tip. Since the sterile part is over, I'm gonna grab a Q-tip. I'm gonna dip it in the clean saline. And so then I'm just gonna grab the Q-tip, dip it, and then, sorry, let me scoot my guy in a little more. Over here. Okay. And then we're just gonna clean it. We're gonna dip it into the clean saline. Like I said, it clean inner to outer, and then toss it. Okay. And then we are going to get the gauze and saline and clean the inner to outer. So they're gonna have saline and clean the inner to outer. Okay. And then toss it and then dry it. So you're just gonna dry it. Okay, inner to outer. And then you just toss it and then you put your final dressing on. Okay, maintaining sterility, everything's clean. Well, you finished your sterile part. So now you're just gonna put the final dressing on. Okay. All right, final dressing is on. Sorry, my head is squeaky. Okay, final dressing is on. Then I'm gonna verbalize changing the ties because we only have one set. Okay, I'll get my new trach tie. Then I will secure the new trach tie before taking off my old one. I will then remove my old ones. And then I assure that I have 2 fingers space to make sure it's not too tight for the patient because you don't want them to be uncomfortable. Then we will position the patient comfortably. Keep them in the high Fowler's position. That is very important after trach cleaning and suctioning. So you're gonna want to leave them there. Assure all their belongings are close to them, and that they have everything close so that they won't have to get up or anything. Make sure that the call bell is in reach, bed is in a low position, the side rails are up, the suction equipment is working properly, their oxygen is on. You want all of that correctly working. And then you're gonna tell the patient you'll be back in 30 minutes. I'm gonna clean up everything. I'm gonna gather everything with my gloves. Okay, then you take them off, make sure everything is clean. So you're just gonna clean that up. And all your areas clean, nothing is left out that's dirty. Then I'm gonna just dispose of my gloves properly, perform hand hygiene, that the call bell's in reach, patient is good, patient knows you'll be back in 30 minutes. And then after you perform your hand hygiene, disposed of the gloves, you will document everything, that the patient's bed is in a low position, the coca, everything, your trach care, all of it. So you want to just document everything. And yes, after that, we are done. We maintained sterile technique through the whole thing. We did not break it. We verbalized everything that we wanted to. And yes, patient is good. We are good. Thank you so much.